Hi dear students. So in today's session, let's talk about hypersensitivity. Immune response may sometimes be injurious to the host. Sometimes the sensitized individuals respond to subsequent antigenic stimuli in an inappropriate or exaggerated manner, and this will lead to tissue damage, disease, or even death. The term hypersensitivity refers to undesirable reactions produced by the normal immune system, including allergies and autoimmunity. These reactions may be damaging, uncomfortable, or occasionally fatal. For induction of hypersensitivity reaction, the host should have had contact with the antigen or allergen. The initial contact sensitizes the immune system, leading to the priming of the appropriate B or T lymphocytes. And this is known as the sensitizing or priming dose. Hypersensitivity reactions have been classified traditionally into immediate and delayed types based on the time required for a sensitized host to develop clinical reactions on re-exposure to the antigen. And this classification is termed as Sells classification. In this, the immediate hypersensitivity is otherwise termed as B cell or antibody mediated, and it mainly consists of antibody causing utilization of biological molecules. And then there is hematologic reaction, which is associated with cytotoxic effect. In this, the IgG and IgM cause lysis by complement. And there are also early inflammatory reactions that include atopic anaphylactic reaction associated with IgE antibodies. And examples of this include hay fever, asthma, urticaria. And another early inflammatory reaction is the Arthus toxic complex associated with precipitating IgG antibodies. And the examples of these reactions include the Arthus reaction and the serum sickness. In the delayed hypersensitivity, it is otherwise termed as T-cell mediated or cell mediated. It mainly includes the infection type and contact dermatitis type. That is the one that is involving perivascular round cell infiltration. The examples of this type of reactions include contact dermatitis, bacterial hypersensitivity, and in TB, that is tuberculosis. And the other one is the infection type that involves epithelial and giant cells. It happens in fungal infections and in tuberculosis. The major differences between the immediate and delayed type of hypersensitivity are shown here. In immediate reaction, it appears and recedes rapidly, whereas in delayed reaction, it appears slowly and it will last longer. Immediate reaction is induced by antigen by any route, whereas in delayed, it is induced by infection, antigen injection, skin contact. Circulating antibodies are present and is responsible for immediate reaction, whereas in delayed reaction, it is cell mediated or T-cell mediated. In immediate reaction, passive transfer possible with serum, whereas in delayed reaction, transfer possible by lymphocytes or other transfer factors. In immediate reaction, desensitization is easy but short-lived. In delayed reaction, desensitization is difficult but it will last longer. The lesions in immediate reactions are acute exudations and fatty necrosis, whereas in delayed reaction, it's mononuclear cell collection around blood vessels. Later in 1963, Coombs and Gell classified hypersensitivity reaction into 4 types based on the different mechanisms of pathogenesis. Their classification is now widely used and They are outlined below. In this, the first one is the type 1 or anaphylactic or IgE or reagent dependent. Type 2 is cytotoxic or cell stimulating. Type 3 is immune complex or toxic complex disease. Type 4 is deloid or cell-mediated hypersensitivity. Now let's see in detail about type 1 hypersensitivity, which is also known as immediate or anaphylactic hypersensitivity. The reaction may involve skin, eyes, nasopharynx, bronchopulmonary tissues and gastrointestinal tract. In skin, it causes urticaria and eczema, eyes conjunctivitis, nasopharynx rhinorrhea or rhinitis, running nose usually. Bronchopulmonary tissues cause asthma, and in gastrointestinal tract cause gastroenteritis. In type 1, the reaction may cause a range of symptoms from minor inconvenience to death. The reaction usually takes place between 15 to 30 minutes from the time of exposure to the antigen, although sometimes it may have a delayed onset, which is something between 10 to 12 hours. Type 1 hypersensitivity is mediated by IgE antibody to specific antigens. The primary cellular component in this hypersensitivity is the mast cell or basophil. The reaction is amplified or modified by platelets, neutrophils and eosinophils. The mast cells get stimulated and they release histamine. So what are allergens? Allergens are non-parasite antigens that can stimulate a type 1 hypersensitivity response. The common allergens associated with type 1 hypersensitivity, it includes foods like nuts, seafood, egg, peas, beans, milk, and certain vaccines and foreign serum, and plant pollens of ryegrass, ragweed, timothy grass, bush trees, and insect products like bee venom, wasp venom, ant venom, dust mites, and drugs like penicillin, sulfonamides, local anesthetics, salicylates. These are all common allergens that is associated with type 1 hypersensitivity. The process and mechanism of type 1 hypersensitivity include the priming stage, the activating stage, and the effect stage. The priming stage lasts more than half a year, and in the activating stage, the cross-linkage followed by enzyme reaction that will be resulting in degranulation of mast cell and basophil. And the effect stage is divided into immediate or early phase response and late phase response. The immediate phase is mediated by histamine, and it starts within seconds and it will last several hours. Whereas in late phase response, it is mediated by newly synthesized lipid mediators, and it takes up 8 to 12 hours to develop, and it will last several days. Let's see the overall mechanism involved in the type 1 hypersensitivity reaction. When the allergen is exposed to the individual for the first time or in the primary stage, there is generation of IgE, and these IgE molecules are bound to surface receptors on mast cells and basophils, and such receptors are called the FcER1 receptors. The IgE molecules attach to these receptors by their Fc end. In the case of secondary reaction, the allergen will bind to the IgE on primed target cell. Following exposure to the shocking dose, the antigen molecules combine with the cell-bound IgE, bridging the gap between adjacent antibody molecules. And this cross-linking increases the permeability of the cells to calcium ions and leads to degranulation with release of biologically active substances contained in the granules. And these manifestations of anaphylaxis are due to pharmacological mediators, which are of two kinds. Primary mediators, which are the preformed contents of mast cell and basophil granules, and it include histamine, serotonin, bradykinin, and the new generated mediators include, or they are otherwise known as secondary mediators, and it include platelet activation factor, that is PAF, prostaglandin B2, leukotrienes, and all these components dilate the capillaries. They increase permeability, increase the mucus secretion, contract the smooth muscle, and this will be generating in systematic anaphylaxis, skin reaction, and respiratory tract reactions and the digestive tract reactions. The chemically active effectors within the granules released via degranulations are called mediators. And this group include primary mediators, which include histamine. It increases vascular permeability and smooth muscle contraction. Serotonin increases vascular permeability and smooth muscle contraction. Then there is eosinophil chemotactic factor, which affects eosinophil chemotaxis, and neutrophil chemotactic factor affects neutrophil chemotaxis. And there are proteases which cause bronchial mucus secretion and degradation of blood vessel basement membrane. The secondary mediators include the platelet activating factor that result in platelet aggregation and degranulation, contraction of pulmonary smooth muscles. Then there are leukotrienes that cause increased vascular permeability, contraction of pulmonary smooth muscles. Then there are prostaglandins that results in vasodilation, contraction of pulmonary smooth muscles and platelet aggregation. There is bradykinin, which increases vascular permeability and smooth muscle contraction. And there are cytokines which causes systemic anaphylaxis. So let's see what's happening in systemic anaphylaxis. The clinical features of systemic anaphylaxis include itching, erythema, contraction of respiratory bronchioles, diarrhea, pulmonary edema, pulmonary hemorrhage, shock and death. And the examples of systemic anaphylaxis include administration of antisera, example anti-tetanus serum, administration of drugs like penicillin. Also, sting by wasp or bee also result in systemic anaphylaxis. Systemic anaphylaxis results in vasodilation and smooth muscle contraction, leading to severe bronchial constriction, edema, and shock, and this is similar to systemic inflammation. Another kind of anaphylaxis is a localized anaphylaxis. It is common and it is affecting about 10% of population. And about 50% of these conditions are familiar with genetic predisposition, and therefore it is also known as atopic reactions. So localized anaphylaxis is also termed as atopic reaction. Examples of localized anaphylaxis include hay fever, which occurs due to pollen sensitization of conjunctiva and nasal passages, bronchial asthma, which is resulted by inhalation of house dust, food allergy by ingesting allergens like fish, cow's milk, cutaneous anaphylaxis due to contact of antigen with skin characterized by urticaria, wheal and flare, angioedema, and autosomal dominant, inherited disorder characterized by laryngeal edema, edema of eyelids, lips, tongue and trunk. The image shows the urticarial or wheal rashes and the angioedema. Now let's see the diagnosis of type 1 hypersensitivity. It includes skin test like prick and intradermal test, measurement of total IgE and specific IgE antibodies against the suspected allergens. Total IgE and specific IgE antibodies can be measured by a modification of enzyme immunoassay, and the increased IgE levels are indicative of an atopic condition. Although IgE may be elevated in some non-atopic diseases like myelomas and helminthic infection. Now let's see the therapy of type 1 hypersensitivity. The first one is the allergen avoidance, and it can be done by the atopy patch test. Second one is the desensitivity therapy or hyposensitization. Includes allergenic serum desensitivity therapy. In this, repeated injection of small amounts of allergen is taken. It is otherwise known as allergy shots. And second way is the specific allergen desensitivity therapy, which will neutralize the antibody and block the antibody. The third way is by the usage of drugs. Drugs that is used for the stabilization of triggering cells like sodium chromoglycate stabilize the membrane and it inhibit mast cell degranulation. And the ones that is acting as mediator antagonism, chlortrimeton for antihistamine and acetyl salicylic acid for bradykinin antagonism. Next one is the allergen immunotherapy. It rehabilitates the immune system and involves administering increasing doses of allergens to accustom the body to substances that are generally harmless like the pollen, house dust mites, and thereby induce specific long-term tolerance. Allergen immunotherapy can be administered under the tongue or by injections under the skin. The basic 4 A's in the management of anaphylactic reaction are antihistaminic agent, adrenaline, aminophylline, and airway oxygen. Others include adrenaline inhalants, hydrocortisone sodium succinate, cricothyrotomy for airway maintenance if required. In this, an incision is made through the skin and cricothyroid membrane to establish a airway pathway during certain life-threatening situations. When a small shocking dose of an antigen is administered intradermally to a sensitized host, there will be a local wheel and flare response. And then measure the IgE levels. The wheel is a pale central area of puffiness due to edema, which is surrounded by a flare caused by hyperemia and subsequent erythema. And this test is used for testing hypersensitivity and in identifying the allergen responsible in atopic diseases. In highly sensitized individuals, even the skin test may lead to serious and even fatal reactions. Hence, a syringe loaded with adrenaline should always be kept ready whenever a skin test is performed to detect anaphylactic hypersensitivity. Drugs like antihistamines can be used for the treatment of hypersensitivity 1 disorders. It competes with histamine 4 receptors. And the other one is the epinephrine. It is also utilized best for the immediate treatment of anaphylactic shock. It reverses the effect of granules. It acts quickly but only for a short duration. Cortisone can also be used because it blocks histamine synthesis. And this table shows the common IgE mediated allergic reactions or hypersensitivity 1 reaction. You can see the syndrome, that is systemic anaphylaxis. It is caused by the allergens, drugs, serum, venoms, peanuts, and the route of entry is intravenous, either directly or following rapid absorption. And the responses include edema, increased vascular permeability, tracheal occlusion, circulatory collapse, death. And when it is when we see wheel and flare syndrome, it is usually happening due to insect bites or during an allergy testing. The route of entry is subcutaneous and there is local increase in blood flow and vascular permeability. In allergic rhinitis, the causative agents are the pollens, dust mite, and the route of entry is through inhalation. And the response include edema in nasal mucosa, irritation of nasal mucosa. And next one is the bronchial asthma, which is caused by pollens and dust mites again, and it is also the route of entry is through inhalation. And there is bronchial constriction, increased mucus production, and there is airway inflammation as a reaction. And in food allergy, it occurs due to the consumption of shellfish, milk, eggs, fish, wheat. Route of entry is through oral, and the reaction includes vomiting, diarrhea, urticaria, itching, anaphylaxis,